Hey guys, Dr. Will here from Miami Spine and Performance. We are back with our patient John here. John is actually an orthopedic surgeon in training, so we're excited to have someone like him here. He's dealing with some lower back pain, a little bit of upper back, and a little bit of shoulder stuff. So we're going to get in and we're going to adjust him. So I'm going to show you guys what a typical adjustment is going to look like here at the clinic. So as you guys know, typically I'll start with the patient seated and I'll just kind of go through a scan, do a little posture correction. So John was just telling me that he's been standing in the OR all week. He's working, nearly 100-hour weeks right now. So definitely some spine stuff to work on. So we can see right here, TL junction always locked up, and a little issue here at the CT. Also come down and check the SI joint. So John, can you reach forward for me towards the carpet? Kind of bend over. Good. So a little issue with this right SI joint here. Come back up, John. And we'll just check the cervical spine. So definitely some muscular stuff through here. Some suboccipital tightness. Joint-wise, not too big of an issue. John is also a recreational jiu-jitsu athlete, so you can imagine there's all the typical kind of jiu-jitsu wear and tear as well. And what shoulder have you had pain on in the past, John?
So I had chronic right shoulder pain for a long time.
Okay.
Luckily, it's been okay, but I always need to work on it.
Yeah. So we can see right shoulder's a little anterior in the capsule here. Very common issue. So we'll get in and we'll kind of break some of this stuff up after the adjustment. So I'm going to have you go face up, John.
Sure.
Repping Miami. Intramural champions.
Flag football.
Flag football. All right, scoot towards me this way. So we're going to start with the CT junction. As I've talked about before, a lot of times with shoulder pain, if the CT junction is locked up, which could be due to long periods of sitting at the computer, poor posture, it's going to be hard to get good shoulder motion. So that'll be the first thing that we'll adjust today. Your shoulders okay here? Feel good? So we're going to go right here. Yes. I'm going to have you switch your arms this way.
Sure.
So now we're going to get the thoracolumbar junction. So kind of right here below the ribs, that area gets locked up actually with long periods of standing, which John was just mentioning to me that he's been standing a lot. I'll copy this way. Nice. Okay, let's have you roll onto your right side, please.
Okay.
Just kind of recheck the lumbar and SI. It wasn't too locked up, but let's see. Just a little one right through there. Okay, take a breath in. Breathe out, drop your shoulders. Perfect. All right, let's check the other side. Doing okay so far?
Yeah, it's great.
They don't teach you this in medical school, do they?
Certainly not.
We love our orthopedic doctors. We always work together. Let's go here. Big breath in. Breathe out. Take it over. Good. Face up. All right. Always like to check the feet, especially if people are standing for long periods of time.
Yeah, I got new insoles, which helped, but
Oh yeah.
you stand this much and it's like you're gonna
Like orthotics.
Yeah.
Yeah. So a little stiff here through the midfoot. We actually might break out the speeder board for these guys. So this is a tool that I'll use a lot to adjust extremities, feet, hands, elbows, things like that. So we're going to just get some motion in the midfoot here. So by adjusting this joint here, the midfoot, this is going to allow John to toe off a little bit better and get a little bit of spring through his arch. Because right now it's kind of stiff, so that's going to not absorb the force of walking too well.
Yeah, I definitely felt stiff. I was doing some lunges in the gym yesterday, and it was really stiff in there.
Recheck. So we get a little bit more spring in there. Check dorsiflexion, also a little tight. Eversion also tight.
Ankle mobility is always an issue.
So use a little yoga block here to support the knee. So now we're going to adjust eversion. Now we get a little bit more motion here. This is another really essential motion for walking and running, is that eversion of the calcaneus, the heel bone. And look at this foot, and this one's even stiffer. So we're going to do that same adjustment there with the heel. Maybe rotate your foot out. And now again, we're just looking for a little bit of joint play. Perfect. All right, John, I'm just going to have you switch to this table for me real quick.
All right.
Face up. So the last thing we're going to do with John is we're going to adjust the right shoulder. The shoulder joint and the hip joint can be a little bit sensitive to the regular adjusting, so I like to use the drop table here just to kind of get some more mobility in that shoulder. Let's have you bend your legs for me, please.
Okay.
Slide down just a little bit. So I'm going to bend the elbow. We're just going to go here. Just put a little pressure on the back of the shoulder. So all we're doing is we're trying to get this shoulder joint, the head of the shoulder here, to drop back into the socket there. So it's a very gentle adjustment, nothing crazy. Good. And then we'll do some inferior glide there. Perfect. All right, sir, come on up. Let's have you grab a seat. I'll recheck everything.
Sounds good.
So we always recheck, right? We want to make sure that we got everything that needs to be adjusted from a joint standpoint. So what I'm looking for in the shoulder here is a little bit more relaxation in the front, right? So the front delt and the pec. By adjusting the shoulder back into the socket, we get a little bit of inhibition or relaxation there. C-chi junction's a little more springy. Can you look all the way up at the ceiling? And I'm looking for motion up in the upper thoracic spine, so that's going to be the area between the shoulder blades. So as John looks up, I want to look for a little dip here, right? That's telling me that now that joint's moving a lot better, okay? Now I'm going to have you cross your arms, John, and rotate to your right, please. And again, here I'm looking for, are all the joints working together? So go ahead and turn to your left. All right, so we're seeing that the whole spine is working together. Before, we were getting too much movement here and not enough movement here. Now last, go ahead and reach down for the floor, John. You can see now SI joints are even. Go ahead and sit up for me. So that's it. So that's what a typical adjustment looks for. You know, John has a lot of common complaints, right? Upper back, lower back, shoulder. These are things that we treat all the time. So we go in, check all the joints, make our corrections, and now we're going to show you guys what we do from a soft tissue and rehab standpoint.